Yes, so what are ideal pre-requirements for the tummy tuck surgery? Or I get many emails that how I can prepare for the tummy tuck surgery. So first thing is you should follow an ideal diet. So you should not follow a crash diet, you should do an ideal diet. So you should avoid the junk food, you should avoid the sweet dishes, and I should not elaborate about it. You all know about the ideal diet. And second is the exercise. Even if you can't go to gym, you just go for a walking or go for a running. I myself go for a running daily. So you should maintain an ideal diet and exercise. And second thing is, if you are planning for the surgery, you should check your hemoglobin levels and the protein levels. Your hemoglobin should be more than 10 or 11 grams, and you can do a blood test for your protein levels. You can increase the protein intake in the form of eggs or non-vegetarian diets, or if you are a vegetarian, you take a lot of cheese, soya, or all dal and pulses. So other important thing is the smoking. If you are a smoker, especially male patients, you should stop smoking at least 1 month before the surgery, because the surgery is done under anesthesia and the healing time is less if you don't smoke. And many times patient asks for the alcohol intake also. Yes, you can take alcohol, but it should be in moderation, not the excessive intake. So you should avoid excessive intake at least 2 months before the surgery. This is the question for the recurrence or whether the results are permanent. So my answer is yes, the results of tummy tuck are permanent, because we remove the extra skin, we remove a lot of skin. That skin is gone forever, and we remove a lot of fat in liters, maybe 3 liters, 4 liters. We remove the fat, so that fat and the skin is gone permanently. But if there is a pregnancy or there is a massive fluctuation in the weight, there are chances that you might get some looseness of the skin and the fat again. So what is my advice to all the clients? They become my friends, so I advise them to follow a healthy diet and a healthy exercise. Though our results are permanent, but we want to improve them with a good diet and with the good exercise. So we get so many queries that what is the cost of the tummy tuck procedure. So the cost is very important, I understand, but this is the surgery which has got permanent results. So you have to get only one chance in the life to do the surgery. So you should choose a surgeon who is a plastic surgeon, and a plastic surgeon who has got all the trainings for the aesthetic surgeries. So you should check his or her results, actual patient results. If you are comfortable to see her results, you should see at least 10 to 15 cases of done by the same plastic surgeon. Then second important thing is the center. The center should have important infrastructure and all with latest medical equipment, and all the safety measures should be there, and the atmosphere should be a homely atmosphere. So I should tell you that Kairos Aesthetic Clinic is built up to the international standards with all the safety measures, and there is a very homely atmosphere. So we get many NRI patients or patients from all over the world, from different countries and from the different parts of the different states of India. So we cater to different types of patients. We get VIP clients, we get clients from the film industry also. And second important thing is whether your surgeon is doing high definition liposuction or not. That is very important, because removing the fat and cutting the skin is not our aim. We want to give a good curves to the sides of the abdomen. We want to give you a waistline definition, and high definition liposuction is always done by the advanced forms of liposuction. So at Kyra Aesthetic Clinic, we are doing ultrasonic liposuction for the last 10 years and water jet liposuction for the last 6 years, and we are doing a lot of fat grafting. So we understand the anatomy of the rectus muscle, how to highlight the muscles, and we give the lateral dips. So there is a natural natural dips here, and we want to give you hourglass shape. So that is the aim of the tummy tuck surgery. And third important point is the navel position, the position of the new umbilicus. So when we give the thinnest part of the waistline, so your navel should be approximately 3 centimeters above that point, and we give a natural dip to the umbilicus, so it should be dipped inside the abdomen, and it gives a very natural look. And the more important is the scar. So we give a scar in the bikini line, so the scar is never visible. Even if you want to wear the sari, or you want to wear a swimming dress, the scar is never visible. It is just under the bikini, and the suturing or stitching of the scar is done with a very fine thread, or we use surgical glue, that the scar should be minimal. You will be amazed to see the results. You won't find from where the surgery has been done.